Welcome to the deep dive where we dive deep. You know the drill. Lots to learn, but not a ton of time. So today we're looking at contemporary art therapy with adolescents.
Yeah, and we've got a bunch of stuff to dig through, excerpts from a book, we've got the foreword, even the introduction, like the whole package.
So the goal is pretty clear, right?
Yeah.
We want to see how art therapy, how it's being used right now, today, to understand and help teens. And I'm really hoping for some surprises, some stuff I haven't heard a million times, some practical tips. So let's get going. First things first, the author starts with a bunch of thank yous.
Oh, yeah, lots of gratitude there. Starting with Kathy Melchiotti for the encouragement, and the author even mentions her humor.
I love that. Already you can see how collaborative this field is, like a real community. And the author thanks so many people, some big names, some folks who are clearly close friends. It gives you a sense of the author's world, right? A mix of academic rigor and genuine support.
Yeah, and it's not just a quick thanks, it's personal. Jean Noble for reading and editing, Amy Loth and Roberta Lengla sharing their experiences, Robert Saldana for the photography of the artwork, and Rita Kufel just for being there to listen.
And to top it off, there's a sweet dedication to the author's sons and their families, talking about faith in the next generation, which, was kind of perfect given what the book's about. Okay, so before we get to the actual content, there's a foreword by Gerald Oster. What did you think?
Well, Alster really jumps right in. Adolescence, a confusing time. He talks about all those demands, from everyone, peers, teachers, parents, even just like society at large. And then on top of that, all those internal changes. It's a lot.
It is. And Oster doesn't sugarcoat it. He talks about family conflict, mood swings, up and down, depression, even learning problems. It could be a recipe for real instability.
Right. And sometimes, he says, it just gets to be too much. For the teens, for the families, everyone. And that's when, well, professional help is needed. Which is, what this whole book is about. Okay. And then there's another foreword. Kathy Melchiotti. A whole different perspective.
Malchiotti really connected with this book on a personal level. You can tell she's been there in the trenches with adolescents, back when she was starting out.
Yeah, and she immediately saw the power of art, for teens especially. Like, it gives them a way to communicate all those emotions they might not even have words for, to explore who they are, to get creative and actually solve problems, and of course, to build that bond with the therapist.
And she makes a great point. A lot of the stuff written about adolescent development, the classics, the stuff that helped her back in the day, well, it's not as useful now. Things have changed. The issues are different.
Exactly. So Malchiotti sees this book as filling that gap. Like, it's got all this clinical experience, but it's grounded in what's happening with adolescents today, the current priorities and treatment. It goes beyond the old theories.
It takes a much wider view. She mentions societal influences, cultural stuff, family dynamics, and then there's all this focus on narrative approaches, which we'll talk about later. And of course, those short-term, solution-focused therapies.
Right. And there's some meaty clinical stuff, like how teenagers use distancing, to protect themselves, the importance of reflection, of timing things right, and understanding that metaphorical communication, it's not always literal.
And if you're looking for how-to, Malchiotti says the book is packed with case studies, real-world examples, and it covers all sorts of settings: group therapy, family therapy, inpatient, outpatient, residential, schools, even individual sessions.
And here's something important. Malchiotti stresses that therapists need to see treatment through all these different lenses. Regional factors, socioeconomic background, race, ethnicity, culture. It can't be a one-size-fits-all approach.
And art becomes this bridge, a way to see those cultural differences, and for teens to share how those things, culture, society, gender, family, how they shape their lives.
She's big on building that therapeutic relationship. And it goes beyond just, like, handing them art supplies. It's about respecting teens, seeing them as the experts on their own lives, really recognizing their backgrounds and responding to their worldviews.
And she makes it clear, this book isn't about diagnosis and assessment. It's about creating a structure for therapy that helps teens explore, change, and grow, not about labeling them.
Absolutely. Malchiotti's main point is this. It's the teens' own view of themselves, of their world, that matters most. And their art, well, that's how they express that view, so the therapist has to follow their lead. Now, let's jump into the introduction. What did the author have to say?
So the author lays out the goal: to look at the problems of adolescence, but through a lens of what's happening today, and to pull you right into the therapy room. The book's for clinicians, obviously, but also for educators who work with teens, Very practical.
And it's based on the author's own experiences.
Yeah.
Decades of work with adolescents. Their reflections on therapy, on how to integrate art theory with practice. Very personal.
Yeah. And for any therapist who might be thinking, is art therapy still relevant? The author is right there with you. They're interested in reevaluating its effectiveness, both practically and theoretically. So it's not just a how-to, it's a why-to.
Right. And then the author gets into development, and they make a really useful distinction. Puberty versus adolescence. Puberty is all the physical stuff, the hormones, the growth spurts. But adolescence is all about psychological and emotional growth.
And those two things don't always happen at the same time. You've got teens who look mature physically, but emotionally, they're much younger. Or the other way around.
Exactly. And the author gives some great examples. You've got those tall boys who still act like 10-year-olds. You've got those physically mature girls who think like preteens. And then you've got those baby-faced kids who are incredibly smart, but maybe struggle because they don't look their age.
Yeah, the teen experience is so individual. And then you add family life, money problems, peer pressure, the whole school system. It's a lot for them to handle.
It is. So what's the point of the book? Well, the author recognizes that teens are tough for therapists. They don't open up easily. So the book aims to be practical. Real-world examples, successes, failures, techniques. Not just theories, but solutions.
Exactly. And sometimes the solution isn't therapy. It's about getting support from the system. But the author's main point, don't jump to labeling the teen as pathological. See them as developing, but within their circumstances.
Right. So it's about helping them where they are. And that leads us to art therapy. What role does it play?
The author says it's not a one-size-fits-all solution, but it offers a ton of opportunities for therapists and clients. It's a way to get past that initial resistance you get with teenagers, to let them tell their story.
Because they often feel like the world is messed up, but they don't trust adults enough to just talk about it. So they use art. It's a silent language, but it speaks volumes.
And the less you pressure them to talk, the more they might actually open up. Because art feels safe. It's under their control. What about assessment? How does the author approach that?
Well, they recognize that assessment is a part of therapy. There are those formal protocols, the tests, and those can be useful, but they're not the author's main focus.
They prefer a more ongoing assessment, comparing artwork from different sessions, looking for changes, and listening to how the teens interpret their own art. It's personalized.
Yeah. And the author cautions against those pre-planned drawing tests. Teens are suspicious. They don't want to be analyzed. So a more collaborative approach is better.
Involve them in the process. Don't force their art into a box. But the author does say that trauma, that's often pretty obvious in the art. It goes from organized to disorganized. And knowing the typical tests, that can be helpful.
But don't let those formulas blind you to what's unique about each piece of art. And remember, everyone creates their own reality. Imposing a test can actually interfere with therapy. Okay, let's move on. The adolescent of the millennium. That's an interesting phrase.
So the author's saying that while adolescence is still adolescence, the classic descriptions, they don't fit anymore. Things have changed.
Yeah, today's teens are pushed to act like adults before they're really ready, emotionally, psychologically. And they cope how? Drugs, risky behavior, anything to escape the pressure.
And the author is pushing back against this idea that all teenagers are irresponsible, that they don't want to contribute. Some do navigate this time just fine. They're not rebellious. They're not alienated.
Right, and sometimes it's that lack of rebellion that makes them feel like outsiders, which is ironic. But then you've got the other extreme, those teens who crave conflict, acting out, alienating their families, even suicidal behavior. It's a spectrum.
And this image of the crazy teenager, the one the media loves, well, it becomes a self-fulfilling prophecy. Adults start to fear teens, they make fun of them, and guess what? Teens live up to that expectation.
And therapists aren't immune to this. We mostly see the troubled teens, right? So it skews our view.
Okay, let's dig a bit deeper into the whole development thing.
Right. Back to puberty versus adolescence. The author really hammers this home. They're separate, but connected. And physical development is so variable. Genetics, nutrition, health all play a role, even ethnicity. The author admits they're not a specialist in those areas, but their clinical experience, that's their guide.
So what are the core principles of art therapy with teens? How does it all fit together?
Well, the author sees a parallel. Adolescence is a creative time. And art therapy, it uses creativity to solve problems, to find new solutions.
And they're not just talking about artistic skill. It's about imagination, even how they behave. Like when a teen figures out a way to avoid chores, that's creative.
Right, so the therapist's job is to tap into that. to suggest art tasks that resonate with the teens' world, to meet them where they are.
And art therapy isn't threatening. It's their art, their control. They reveal what they want when they want.
Of course, there are those accidental revelations, the stuff they didn't mean to show, but that stays private. It's their choice. This leads to the early alliance, that first connection.
So crucial, especially with teens who don't want to be in therapy. It's about being non-confrontational, flexible.
Yeah.
And imagery, that's the key.
Yeah, and it's got to be done right. Teens are smart. They know about interpretations, tests. So art therapy can't feel like a trick. Okay, next up, metaphorical communication.
So a metaphor, it's like saying one thing, but meaning something else. And the author says teens use metaphors all the time. It's their language.
It shows their creativity. They don't always follow those adult rules of grammar and stuff. And that's great for art therapy. It allows for really individual treatment.
Because art itself is metaphorical. The images are symbols. They have deeper meanings.
And the therapist has to work with that. Don't jump to conclusions. Validate the image, stay with it, let the teen lead the way.
And they actually like talking through metaphors. It's less direct. They can explore those tough feelings from a safe distance. Okay, what about polarity drawings? I haven't heard of those.
So sometimes you just give them art supplies and let them go. But the author also uses these polarity drawings. It's about exploring both sides of an issue.
Like, how do your parents punish you on one side? How do you punish your parents on the other? It gets those power dynamics out in the open.
Right. And the discussions are great. It's all that classic teen stuff. The loud music, the ignoring, the selective hearing.
But here's the twist. Ask them, how would you handle this if you were the parent? And suddenly they're drawing these corrective pictures. More rational, more thoughtful.
Makes you wonder, right?
Ah.
Okay, another big topic. Supporting gay and lesbian adolescents.
Yeah. The author says helping these teens through coming out, that's a huge deal. And it can be really tough, especially depending on the family.
And there are always identity issues to explore. But while there's more support now for LGBTQ plus teens, therapists need to keep up with resources to really help.
And art therapy can be that first step. It's nonverbal. They can tell their story, express their identity before they're ready to talk about it. Now let's get into narrative and social constructionist approaches.
This is about how we see communication. The idea is that our thoughts, even our memories, they come from social interaction, from talking to each other.
So therapy, it's not just about fixing the individual. It's about creating a new story through dialogue, a new narrative that gives the client hope, a way to change.
And teens like this approach. Changing a story, that's easier than changing their whole behavior. It's less overwhelming.
And art and narrative, they go together, right? A story needs pictures. Art therapy is perfect for this. Okay, now the author asks, considerations for adolescent group therapy.
Some really big questions here, like has group therapy lost its effectiveness? You know, with all the changes in society, the pressure on families, the violence, early sex, shifting values.
And are therapists really paying attention to these changes? Are they dealing with the tough stuff?
Big questions, and the book explores this in detail. So, moving on to treatment issues, pragmatic and clinical realities.
The author isn't afraid to say it. The problems teens bring to therapy, they're complex. It can feel overwhelming. Like, are there even any successful teens anymore?
In treatment these days, it's all about crisis. The highest risk kids get the attention. Long-term therapy, forget about it.
It's sad, but true. We've lost sight of prevention. And to get treatment, well, you need a diagnosis, a label.
In group therapy, it's cheaper, so it's often the go-to. But is it always the best for the individual?
Okay, what about fundamentals of clinical art therapy in groups?
So despite all these changes, the author says the basics of art therapy, they still work. They're effective, especially in groups.
And art therapy is unique. It offers creative opportunities in groups. And teens respond to that. It lowers their resistance to therapy.
So we've got individuation and peer influence in groups. Adolescence, it's always been about separating from the family, becoming your own person.
But nowadays, it's more about moving away but staying connected. It's a balancing act.
And that's where peers come in. Teens rely on each other for support, even though, let's face it, their peers are just as clueless as they are.
But they'd rather be in therapy with your friends than alone. It's less stigmatizing. And art, well, that's more appealing than just talking. Okay, the author gives an example. Group dynamics around sexual issues.
This is a good one. A 13-year-old girl asks the group, "When should I lose my virginity?" And the group clams up. They avoid the question.
They hide behind their drawings. And those drawings, bad copies of rock album covers, anything to avoid the real issue.
And for this group, virginity wasn't a big deal. It was more about social status, What would happen if she did or didn't have sex? Would it make her cool or a loser?
The boys in the group, they were all about traditional gender roles. Girls were objects. Their drawings showed that.
But no one challenged those views, so the girl was stuck. Have sex and be judged. Don't have sex and be ostracized. No good options.
And in another group, the author remembers, they talked about female orgasm. And the girls, blank stares, like they didn't believe it was a thing. It's wild how different their worlds can be.
So the therapist realized that trying to guide her directly, that wasn't working. She needed to figure it out on her own terms.
Yes. But the act of asking the group, that was the therapy. And her drawings, crossroads, question marks, a baby,
Yeah.
they gave her space to think, to process it all. Non-verbally, but with her peers there. Okay, confidentiality, huge in group therapy.
The author is adamant about this. Set those boundaries early. Be clear about what you can and can't keep private. It avoids problems later.
And teens need to know that if something serious happens, if you have to talk to their parents or the authorities, they'll be there with you.
And don't break confidentiality unless it's to protect the teen. And include them in the process. Be transparent. It builds trust. So, shaping the adolescent group.
A lot of those rules for adult groups, they don't work with teens. Like no outside contact or focusing only on what happens in the group, that's not realistic.
Teens, their main concern is confidentiality from everyone. Peers, parents, the outside world. That's how you create safety.
And those deep group attachments, the ones you see in adult groups, they take time with teens. Longer, more consistent groups allow them to get past their own self-centeredness, to actually care about each other. What about the therapist's role? How do you handle a group of teens?
It's tricky. Be involved, but don't control. You have to walk that line.
Be somewhat transparent, but always honest. Teens can spot a faker a mile away. And if they think you've betrayed their trust, forget it. You're done.
And honestly, not everyone's cut out for this work. You got to have a sense of humor, you got to be comfortable with the tough stuff, and you got to remember your own teen years, all the pain, the confusion. You need that empathy. So what about the teens themselves? What's their focus in the group?
Well, they're pretty self-centered, the author says. It comes with the territory. They're figuring themselves out. They don't have a lot to give to others.
Giving feels like losing. It's too risky. And they find their identity in the group, right? The clothes, the music, the slang, even their stance on sex and drugs. It's all part of belonging.
But that belonging is conditional. You step outside the group norms, you're out. And deep attachment to the whole group, that's tough. They might have a best friend, but that's different.
Right. It takes a long time, a stable group, for teens to develop that kind of connection, to move past their own needs. Okay, so how do you use all that teen talk to create art tasks?
The author says, just listen. Pay attention to what they're talking about, their concerns of the day.
And then turn those into art tasks. Like if they're complaining about parents, curfews, whatever, ask them to draw how they'd handle it if they were the parent.
It's a way to explore those roles. What makes a good parent? Are the rules fair? It gets it all out of the open. So, getting started with adolescent groups, any tips?
Don't expect miracles. Teen groups, they take time. The therapy is often just being there week after week, providing a safe space, a consistent adult presence.
Yeah, and the art tasks work best when they come from the teens themselves, their conversations, their interests.
And they might be scared to put their feelings on paper. But if you're there, supportive, not pushy, they might just take that risk.
And if they're really resistant to art, well, frame it as a skill, a craft. They can learn something. The therapy will come later.
And don't jump into the heavy stuff too soon. Be ready to back off if they shut down. You're planting seeds. They take time to grow. Narcissism and maturity levels in groups.
Teens, they can be pretty narcissistic.
Yeah.
And they don't tolerate differences in maturity very well. It throws off the group dynamic.
Helping each other, that's hard enough as it is. But if they're all at different levels, it's impossible. Some will be bored, others will feel overwhelmed.
So matching teens who are at similar stages, who have similar issues, that's key.
And those individual assessments before group, they're crucial. You can learn so much from that first session, what they draw, how they draw it. It tells a story.
And younger kids, especially, they often do better in single-sex groups. Boys and girls together, that can be too distracting at that age. Now, the author tells a story about an impossible group.
7 boys, 11 to 13 years old, totally distrustful. Of each other, of the therapist, more like latency age, really.
They wouldn't do anything. Scribbling, testing limits, wannabe gangsta talk, drawing, baby stuff, collage, ripping and tearing.
Okay.
For throwing, not sculpting.
It was a nightmare until one day the therapist brought in construction paper, sticks, glue.
And one boy started building a castle, and that was it. Everyone wanted to build a castle.
And they were all fortresses, right?
Yeah.
High walls, towers, drawbridges up, one tiny entrance barred and chained. It was a perfect picture of how they felt. So, not knowing, that's a technique the author talks about.
Yeah, as a therapist, it can be helpful to not be the expert, to let the teen teach you.
If they're willing to explain, to show you their world through their art, that's when the real work begins. And the author recommends some specific art tasks to get at that ambivalence, that back and forth teens experience.
So drawings like what your parents want versus what you want, or the best and worst things about boys, girls.
Even just dividing the paper in half, it gives them permission to express those conflicting feelings. And then they can see that their peers, they feel the same way.
And here's a trick. Ask them for help understanding adults, their values, their world. Teens love that.
They can be surprisingly critical, but they also offer solutions. Okay, what about those adult projections? How does the therapist handle that?
It's inevitable. The therapist is the adult in the room. So the teens project all their stuff onto you, all their frustrations with parents, teachers, whoever.
So don't be defensive. Remember your own teenage years. You weren't always right, were you? And the author suggests some art tasks around this.
Like draw the ideal therapist. Or point out when the therapist sounds like a parent. It opens up the conversation. Okay, navigating sensitive issues in group, that's a big one.
Well, you got to be ready for anything. Maintain confidentiality, but protect the teens. Sometimes you have to break that confidentiality. It's about knowing when to act. It's tricky.
It is. Okay, let's shift gears a bit. Let's talk about depression in adolescence and how society plays a role.
The author starts with this quote from a teen. They said, "You guys screwed it all up. Don't expect us to try and make it work." Like, what hope is there?
It's bleak. And therapists are under pressure, right? From the mental health system, from the courts, to fix these kids. And the numbers are scary.
So many teens in trouble with the law, residential facilities, detention centers, they're overflowing. And it's not just those kids.
Right. Affluent teens, they're depressed too, hopeless. And they don't trust therapists. They don't want help.
And their behavior, the acting out, it's often a cry for help, a need for early intervention, but there's no funding for that, especially if they're not, like, actively suicidal.
Okay, let's talk about the symptoms of depression. What are we looking for?
The usual suspects: sadness, crying, irritability, boredom, no interest in things they used to enjoy, sleep problems, changes in appetite.
Restlessness, can't concentrate, feeling worthless, guilty, empty, lonely, hopeless.
And then there's suicidal thoughts, of course. And often there's a history of other problems, behavior issues, trouble in school, anxiety, family problems.
So it's tricky, right? Is this just normal teenage angst? Or is it something more serious? The therapist has to be sensitive to look at what's going on inside the teen and in their environment before slapping on a label.
And if there's suicidal intent, that's a red flag, especially if they're severely depressed, if they've hurt themselves before, if there's a big stressor in their life.
And look for signs of planning. Did they try to do it when no one was around? Did they leave a note? Those are bad signs.
Yeah.
Now, there's this idea that acting out can mask depression.
Yeah, Malmquist, he's a big name in the field. He said that teens often act out, they get in trouble to avoid those painful feelings of depression. Better to be angry than sad.
I mean, the author has seen this too. For years, they've worked with these kids, and once you get past the behavior, there's often this core of depression.
And some teens, they're just wired for depression, hypersensitive to criticism, guilt, shame, low self-worth, and then there's masked depression.
Perry Jones, he's another researcher, he talked about this. The symptoms are more subtle. Boredom, bad grades, physical complaints, fatigue.
Reckless driving, promiscuity, drugs, alcohol, anything to escape the emptiness. And sometimes depression and conduct disorder, they go together.
In fact, a lot of teen suicides, they're preceded by antisocial behavior. Now, the author shows some examples of teen drawings, images of depression.
Yeah, there's one, it's a figure trapped inside themselves, a door's open, but they can't escape. It's about that struggle for autonomy.
Another one is just this explosion of anger, raw emotion. And then there's a teen at the bottom of a well, no way out. Pure hopelessness.
And one shows a girl trapped by depression, scared. She ended up in day treatment for her own safety. These drawings are powerful.
They take those suicidal thoughts, those words, and turn them into something concrete, something we can see. And they're creative. Even in their despair, Teens find a way to impact the world.
There's another example. A teenage girl, hospitalized for severe depression, multiple suicide attempts. She used art to communicate.
One drawing, it's this chaotic wheel of emotions spinning out of control. Then, a few days later, all the color's gone, just blackness, depression taking over.
The staff knew right then she was in crisis. They put her on suicide watch. And then later, another drawing. The wheel is slowing down, some colors coming back.
She said she'd felt depressed her whole life. And the art, it was her way of telling people she needed help when the words wouldn't come out. Now, her family, they weren't abusive, but they were messed up.
Always fighting. She felt ignored, like they didn't care. So maybe it was a combination, right? Chemical imbalance and a terrible home life.
She didn't remember ever being happy. And her parents, they just yelled at her when she screwed up at school or with friends. So she tried to kill herself to get their attention.
And the art therapy, it worked. It became a barometer of her mood. Up, down. The staff knew when to intervene.
Okay, let's talk about the bigger picture. How is society impacting teens today?
There was this study, the Carnegie Council on Adolescent Development, back in '96. They found that almost half of American teens were at risk.
At risk for what? Drugs, alcohol, unprotected sex, violence, delinquency, eating disorders, depression, serious stuff. And it crossed all demographics.
So even good families, they weren't immune. Which makes sense, right? If society itself is depressed about the future, well, teens are going to pick up on that.
And no wonder schools and social services are sending so many kids to therapy. But it's not always successful. Teens are resistant. They don't think they need help.
And here's the thing. When teens are dealing with poverty, violence, discrimination, their depression, it's a reflection of their environment. It's not some internal flaw. It's the system that's broken.
The author gives an example, a 14-year-old boy, depressed,
Yeah.
suicidal, forced into group therapy. He wouldn't talk in family therapy.
He lived with his mom and stepfather. The stepfather was verbally abusive, called him names, said he wasn't manly enough.
The kid was tall, thin, blonde, withdrawn. Didn't say much in group, but his drawings, they spoke volumes.
One drawing, it was him behind bars wearing a dress. His stepfather called him a sissy. Another, he was trapped in this dark shape labeled depression, and "No one understands me" written above it.
He drew himself being pierced by arrows. Each arrow had a label. You were so sensitive. Why can't you be like other boys?
And barbed wire all around him. No way out at the top. He felt attacked, trapped. And then a final drawing. He was standing on his stepfather's head. I got him.
And the group, they got it. They supported him. And that was the turning point. He started drawing out his anger. He started talking. He wasn't so depressed anymore.
So situational depression, right, caused by his environment. He couldn't control it. Now, there's some interesting research on gender differences in depression.
Gilligan and her team, they look at how boys and girls express distress. And it's not as clear-cut as you might think. It's not just girls internalize, boys externalize.
Both sexes do both. But for girls, those family connections, those are crucial. Low self-esteem, feeling powerless, those are linked to depression. The author gives an example. 15-year-old girl. Cheerful, talkative, good grades, tons of friends. But she missed a lot of school.
And in her art, there was this sadness. A collage with a sad face, a picture of food with lots of food sick written on it. And a girl hunched over on some stairs, labeled unhappy.
And the girl in the picture, she looked just like the client. So the therapist asked, why is she unhappy? And the girl said, she can't have babies. She just had a hysterectomy.
It turned out she'd been in the hospital for 3 days, a hernia operation. But because her family didn't communicate well, she thought,